The research question I propose is, what is the relationship between rural and remote communities' access to palliative care and the distance of primary address from regional hospitals? Underlying issues include the effect of community education on willingness to engage and the availability of appropriate services. The research includes two key areas. The initial phase requires review of administrative health records accessed through the Western Australian Data Linkage System. The system is a collaborative research database led by the West Australian Department of Health, University of Western Australia and the Telethon Institute of Child Health Research. The Australian Census definition of rural and remote would determine eligibility for inclusion and also identify communities with strong Indigenous cultural identity. Search criteria include inpatient hospital morbidity, access to palliative care treatment and death notification to determine a correlation between place of death, provision of palliative care and primary home address. Phase 2 requires a bi-phase survey tool requesting feedback from community health centre staff and Aboriginal liaison officers, an information program explaining the definition of palliative care and availability of current local service would be provided between the delivery of pre- and post-surveys. The post-survey tests the hypothetical theory of informed knowledge, increasing social expectations. The random stratified sample method has been selected to maintain equity in sample composition and ensure service provision and needs of vulnerable groups are represented. The focus of the survey aims to identify whether community health centre staff and Aboriginal liaison officers have an awareness and understanding of palliative care services in their community. Comparisons of pre- and post-survey results identifies the influence of awareness on the likelihood for professionals to engage in service. If the likelihood of engagement does not alter following delivery of information programs, this may indicate that current services do not meet the cultural, economic or social needs of the community.